Good morning. Is everyone good? Excellent. We're recording and reporting 3 new cases of COVID-19 in Queensland. 2 of those were overseas acquired and detected in hotel quarantine, but 1 was locally acquired. That means we have 36 active cases, 1,761 total cases so far. We did 9,311 tests in the last 24 hours and more than 10,000 vaccines, 10,447, nudging us ever closer to that 2 million mark, which we hope to pass. This week. As I mentioned, unfortunately, we do have 1 case of local transmission. They're unrelated to any of the existing outbreaks that we have been monitoring. They have been infectious in the community. It's a Queensland woman who's on the 10th of July, the Young and Jackson Hotel. We believe they have been infectious in the community from the 15th till probably the 17th of July. The Chief Health Officer will outline a number of contact locations of concern, but in particular and of most concern are those on the Sunshine Coast, including a restaurant called the Rice Boy at the Mooloolaba Wharf and also Sunshine Plaza. She has also travelled to Cairns and Mareeba, and so we'll be providing further information about possible contact sites there. She was fully vaccinated with both doses of the Pfizer vaccine, but this incident and the risk here underlines just how important the restrictions that we currently have in place are. The reduced density requirements at hospitality venues and the wearing of masks will have reduced the risk of further community transfer here. But it is absolutely critical that anyone who has travelled to Victoria, New South Wales or now South Australia monitor those websites for which contact locations are of concern and follow those directions very, very closely, and of course monitor their health very, very closely. That's where the risk of community transmission here in Queensland is. It is in Queenslanders and people coming to Queensland who have been at those locations. In the last 24 hours we've learned that the Sydney outbreak has spread further into South Australia, and the South Australian Government have implemented restrictions there. We'll be reciprocating those restrictions here in Queensland as we do with all hotspot arrangements. In the last 5 days, every one of the last 5 days, New South Wales has recorded more new cases than Queensland experienced during the peak of the pandemic last year. In fact, 9 of the last 10 days, they recorded more than that 78, which was our peak here last year. Tragically now, 5 people have died in this outbreak in New South Wales, in Sydney, and you'll recall that we experienced 7 deaths from this deadly virus here in Queensland through the entire pandemic. So it's absolutely tragic to hear of another death in New South Wales. The message really to Queenslanders is now is not the time to be holidaying interstate. If you have plans to holiday interstate, please reconsider them. This virus is spreading to other states, and we don't know what the situation in South Australia will be in coming days, in Victoria, so it's absolutely vital that if you have plans to holiday, please reconsider them. If you are currently in those states, now would be a good time, if you can, to please come home. The other thing we're urging people in Queensland to plan today is where you plan to be tomorrow night. Today is the day to consider where you will be tomorrow night when we hope to win the 2032 Olympics for Queensland. In 2032, imagine watching the opening ceremony and thinking back to where you were the night we won the Olympics. That's what tomorrow night is all about. It's a chance for parents to create that memory for their kids that they will look back on in 2032. So whether you want to watch it at home with your family, whether you want to go to one of the live broadcast sites, and there's many of those throughout the city and the state, if you want to see the fireworks or the concert, head to South Bank or into the city. Tomorrow, we hope, will be a huge and fantastic day for Queensland. The Olympics will bring billions of dollars of investment and many thousands of jobs. So just give some thought today to where you want to be tomorrow night when we hopefully win the Olympics.
So 3 new cases in Queensland overnight, 2 of them in hotel quarantine acquired overseas, and then the third one is a community acquired case. Now this third case is not linked to any of the other clusters that we currently have active in Queensland. It's brand new. So it is a woman in her 20s who lives up in Mareeba and is studying down in Victoria at the moment. So she came home for the holiday break. So she travelled from Victoria on the 11th of July. Maybe if I can just go to my notes here because it's quite... Right, so she travelled from Melbourne to Maroochydore on the 13th of July, and she received an SMS from Victorian health authorities on the 15th of July because she had been at the Young and Jackson pub on the 10th of July, and that was declared a Tier 1 site by Victoria. So she then immediately went and got herself tested, and she tested negative. She then went out and about in Maroochydore. So on the Thursday, she was staying with friends in Maroochydore, and then that afternoon, from 3:55 p.m. till 4:15, she went to the Sunshine Coast Plaza and specifically visited the Universal store there. We're just getting additional details now of what other movement she had. Then from 6:45 till 8 p.m. that night, and this is very important, she attended the Rice Boy at the wharf at Mooloolaba. So it is really critical that anyone who attended the Rice Boy restaurant at the wharf at Mooloolaba between 6:45 and 8 p.m. that night, Thursday 15th of July, to immediately come forward and get tested and isolate until contacted by public health as to what else they need to do. Then the following day, on Friday the 16th of July, she travelled via Uber at 12:50 p.m. to Maroochydore Station. Then caught the 615 bus to Landsborough Station. Then went by train from Landsborough to Eagle Junction. Then caught the air train to Brisbane Airport, and then caught Virgin Flight VA791 to Cairns. Arrived in Cairns, where a relative picked her up at the airport, and she drove home to Mareeba and has been at home isolating from then until she went to the Atherton Fever Clinic at 10:30 a.m. on Sunday the 18th when she was tested, and we got that positive result late last night. So she did have some symptoms, so we've deemed her infectious period back to the 15th of July, and that's when she had a negative test as well in Maroochydore, so that was reassuring. Now she is fully vaccinated. She's had both doses of vaccine, the second one back on the 10th of May, so that is really good, which does reduce the risk, but it doesn't remove the risk. So it's really important, particularly those people who are at the Rice Boy, and I understand it's a very popular restaurant at the wharf at Mooloolaba. Anyone there, really, you must come forward and get tested. The rest of the time, she's gone through with us all of those details and all of those public transport movements. She was wearing a mask, and of course we require anyone in the Sunshine Coast as being part of the 11 LGAs in South East Queensland to be wearing masks at the moment, and she wore a mask on the plane. So we will of course be contact tracing everyone on that flight, VA791, on the 16th of July. So I just reiterate, this time, while we have so many cases occurring throughout the country with very little notice, such as has just recently happened in South Australia, it is really important that everyone here follows our requirements to wear masks. So hopefully by all those people in the Sunshine Coast having been wearing masks during that period, we'll see a reduced risk. But it's really important that people continue to wear masks, continue to practice social distancing, wash their hands, check in everywhere. So we'll be going, of course, to that facility and asking for all that check-in data so we can directly contact people as well as putting the message out through media. And then also, people at the moment, I strongly recommend that people holiday in Queensland, that they don't go interstate for holidays. That's not essential, it can be delayed. Please just holiday in Queensland because we don't know where the next case might be. And specifically today, anyone who's in South Australia should really reconsider whether they should come home, and people should not be going to South Australia given the restrictions that the South Australian government has just put in place. People should really reconsider their need to travel to South Australia at this point in time. Thank you.
So just to remind people, if you are in South Australia, they have put in restrictions across the entire state, and we're waiting to hear whether there's any new community transmission cases today. This could change very quickly in South Australia, so we do say to any Queensland residents who are in South Australia at the moment, you should consider coming home sooner than later. Of course, we've already got restrictions in place in relation to Victoria and many of the local government association areas of New South Wales as well. Sadly, we've heard overnight the tragic news in New South Wales where a woman in her 50s died at home from COVID. This is a stark reminder to all of us the deadly nature of this virus. The first case in the New South Wales cluster started 5 weeks ago, and in those 5 weeks, 5 people have lost their lives. Also, in those 5 weeks, we have seen the number of cases across the country increase tenfold. We are now at 1,360 cases across Australia, where only 5 weeks ago we were down to 127. We now have transmission from that New South Wales cluster in Victoria, South Australia and Queensland. So we remind everyone to follow the rules, to not be complacent, not assume that you've got hay fever or some other condition. If you have a sniffle, if you have a cough, if you have a sore throat, please go and get tested and wait for your results. If you have been travelling interstate, please constantly check the exposure list sites on the Queensland site and also the jurisdiction that you have travelled from. And if you have been on the Sunshine Coast, please check the sites that we are putting up today. It is really important that people look at those sites, if you have been there in those times, to immediately register that you have attended those sites through the Queensland website, and also to get tested and await for advice from Queensland Health. For anyone who should be quarantining at home, we remind you that it's a lawful direction to actually stay at home. And also it is a lawful requirement for you to comply with directions from other jurisdictions if you have been to their exposure sites. This is about keeping everyone safe, including you yourself, but your family members, your friends and loved ones. We're very pleased in this case that the individual was fully vaccinated. Mask while travelling, and of course the Sunshine Coast is one of the local government areas where we still have the mandatory restrictions around mask wearing as well. So we hope that this has significantly reduced the risk, but we can't be complacent. We need everyone who has gone to those sites or live in those areas, including Cairns and Mareeba, or have been on that flight, to come forward and make sure you're getting tested and following the advice. We want to keep everyone safe.
So our operational responses in the last 24 hours have seen 30 masks handed out to the community. Unfortunately, we had to issue a $206 penalty infringement notice to one male person at Burpengary who refused to wear a mask yesterday. At our road borders, 1,446 vehicles intercepted, 14 turned around, one person put into quarantine. At our domestic air borders, 1,823 persons processed, 5 refused entry, 116 in quarantine, and 2 have been issued with penalty infringement notices for false declarations trying to enter into the state. So that is disappointing. People trying to get into this state by giving false particulars carries a very severe penalty of over $1,300, so please don't do that. We will find you. We check everyone at the airports. Internationally, 179 passengers have arrived and aircrew. On our heavy vehicle operation, I just want to go into some detail around that. In the last 24 hours, we intercepted 163 heavy vehicles. We found on this occasion that 46 have not had the appropriate passes, having come out of either coming in interstate or actually coming out of a hotspot, of which there were 10. Whilst that's some improvement, not great improvement. So we are saying very strongly to the truck drivers out there, the freight drivers in the industry, please work with us on this. It is incredibly important. It's not just about having the right documentation, because of course these freight drivers do have an exemption and we do need to keep supply coming into the state, but we need that documentation done to verify where they have been from, to mitigate the risk of the spread of the virus, but also to contact trace down the track should we need to. We're going to continue this operation, so the message is out there, expect to get pulled over and expect there to be penalties if you're doing the right thing. And unfortunately, 4 drivers, because of the way that they'd falsified records and the way that they'd operated, were issued with $4,135 penalty infringement notices and 5 further with traffic infringement notices as well. So we'll continue this operation for the foreseeable future. We are working very closely, as I said yesterday, with the trucking industry and the national regulator. We expect it to improve. But as I said, the message is out there to all of them. Expect us not to go away. We'll be there waiting for you. Thank you. Sure. No, look, I'd be very surprised at the case. It's really clear that the NRL has a specific exemption that the Chief Health Officer is issued, and it's a particular regime that's in place. We're across that. We understand how that works. The role of, I'm not sure which officials you mean, but certainly from the police perspective, was simply to process people and make sure they got into the state and into the quarantine arrangements. That quarantine not being part of our hotel quarantine arrangements. So I'll be very surprised about that, because it's very clear that they're within a specific arrangement. I would tell my officers, and I'm sure Health would all the time, to do exactly what they should do, very professionally and truthfully. Wouldn't tell people to do the wrong thing.
So you're not aware of it?
No. Not aware of that specifically at all. I know there's been questions about it, but I'm not aware of it.
It'll be Delta variant, because that's a variant that's circulating in Victoria at the moment, and she went to a pub where she was a close contact, where Delta was circulating. Yes, yeah. So she travelled on the 13th of July. Today's only Tuesday, so we'll see how we go this week. Yes. Yes. On the 15th. Yes. I don't have all those specifics yet, so we found it out about this very late last night, and she's been extraordinarily helpful in going through all of those exposure sites. So the most important one from my point of view is the Rice Boy restaurant at the wharf at Mooloolaba. It is critical that people immediately come forward and get tested if they've been there. I am concerned, of course I'm concerned, and we'll just have to see how it flows out over the next few days. I'm most concerned about her household contacts in Maroochydore and up in Mareeba, so as soon as we've got those results, I don't have them yet, and then that'll give me a sense for what the risk is. No, I don't have all of that specific information yet. Friends in Maroochydore, yes, and family in Mareeba. Well, she was only at the Sunshine Plaza for 20 minutes, so we just need to get more information about where she went and exactly what she did there, whereas she was at the Rice Boy for quite a significant period, and we know that hospitality venues, because you don't need to wear a mask once you're seated, are a higher risk. Thank you.
B-O-I. B-O-I.
Any other non-spelling related questions? No? All good? Oh. Yep. Yeah. The arrangements at the live sites will be exactly the same as elsewhere in southeast Queensland. You'll need to be wearing a mask unless you're seated and eating or drinking. I'm happy to let the Chief Health Officer address that too, but these arrangements will be the exact same arrangements that we have throughout the southeast, and they're based on the best possible health advice.
That's why I'm out here messaging today that people who've been to the Rice Boy restaurant in Mooloolaba, it's really important you come forward and get tested, and then we'll contact trace people who've been on flights and trains and so forth. I think all of that will help us then assess what risk there is going forward. The risk in Brisbane is no higher than it has been. We still have those other clusters, so it is really important that people continue to wear their masks. The only place you shouldn't be wearing a mask is where you're outside, strenuously exercising and you're maintaining physical distance. If you're inside in a workplace and you're maintaining physical distance, you're in an office by yourself, you're in your car by yourself, but most places people should be wearing a mask. The only exception, of course, is where people are seated, eating and drinking, and we know that's a risk, but there's no alternative to that. Or if you're seated in an outdoor stadium in a ticketed seat, and while you're seated in that ticketed seat. But if you're out and about at a outdoor venue, hopefully seeing the results for the Olympics, then you need to wear a mask because you won't be in a ticketed seat. Thank you. Yes, on the 17th of July. I'm sorry, I can't hear you. Yes, yes, he's going through that at the moment. Yeah, it's still ongoing, yes. Thank you.
Thank you.